To bring the opioid addiction epidemic to an end, there are two things we have to do. We have to prevent new cases of the disease, and we have to treat the people who have the disease. You have to do both. If you only focused on preventing new cases of the disease by curtailing the overprescribing, and you don't ensure that people who are already addicted are accessing effective treatments, then heroin and fentanyl keep flooding in, and overdose deaths will remain very high until that generation ultimately dies off. So you have to also see that they have access to treatment. And if you were to only just focus on treatment and do nothing to prevent new cases of opioid addiction, then the epidemic never ends. You keep having new cases of people that have to be treated.
I want to make the point that this starts with a doctor-patient relationship. A physician has the responsibility to practice the best medicine they can on behalf of their patient. That's an expectation that the patient has. And there will be times when that physician should and frankly must prescribe narcotics. But there are also going to be plenty of times when they shouldn't, because it opens the door to a cascade of many bad things happening down the road. So we want to educate patients as well that, you know what, you trust your doctor, you should trust your doctor, but you should also be well educated as a patient about what to expect and what does make good sense and what doesn't. And I think part of it is a cultural phenomenon that, yeah, nobody wants to be in pain. But getting a narcotic drug for what is a relatively minor pain makes no sense. So what can we do to educate you as the patient about what makes good sense?
I would start with a massive educational campaign, the same kind of educational campaign and awareness that they did for any other new kind of emerging disease. The second thing is there needs to be more easily accessed, clear information for people in the community. They shouldn't have to go to 17 websites or try to sort it out or find out who knows. And then for people who are actually coming into the treatment system, they just need more community-based resources. If you're in an outpatient program, you're going to see your outpatient counselor maybe a couple times a week for an hour. That's not going to do it. We need a robust support network for people in early recovery and for families that is going to last for a long period of time.
If I were in charge for the day as an autocrat, I would make a policy that education about addiction and alcoholism need to occur in our school system, not scare techniques, but factual information. I would educate and have parents become part of that education process so that they understood the risk. If I was in charge for a day, I would have politicians enact legislation that would make a requirement that physicians learn about addiction before they get a DEA license to prescribe addicting drugs. If I was in charge for a day, I would have insurance companies stop paying so much for addicting drugs and start better paying for interventions and treatments to deal with the unintended consequences of addiction to prescription drugs. If I was in charge for a day, I would ask our judicial system to stop treating addiction as a crime and start treating it as a disease and thinking accordingly. If I was in charge for a day, I would ask politicians to appropriate the appropriate resources to deal with the problem, both for physician education, parent education, high school student education, grade school student education. And I would stop rewarding overprescribing doctors. If I was in charge for a day, I would give the DEA expanded tools to go after doctors who are clearly prescribing outside the norm. If I was in charge for the day, I would ask the media to carry this story day in and day out. Everybody has to accept their little piece of responsibility for this and do their part to fix the problem. As long as everybody's saying, pointing the fingers and blaming somebody else, is not going to get done.